And I just, if you can raise your hands when I call your, announce, introduce you, that would be great, so they know who is who.
Dr. Singh, are all the panelists here from your team?
Tim, are you here?
Timothy.
I don't know if Tim is here yet. Let me check in with him.
Let's have everyone mute until it's their turn, please. We're delayed a few minutes while we set up the or finalize the translation. So just know that we have a few more minutes. We'll start.
What background y'all like better?
Okay,
That
we
one.
have everybody in.
The one you're in already. Okay.
I'm sorry, Dr. Singh, can you repeat that?
We have everybody in now.
Great, thank you. I'm just waiting to make sure that our interpreter is set up and ready to go as well. Thank you for your patience. I'm waiting for the clearance from our K-Learn Communications Department. We're having one slight delay on the audio that we're fixing right now.
Can you be okay now? Yep, I'm unmuted again. Still have an echo or?
Not as much.
Should I- Does that still get the echo? Okay, testing again to see if there's any echo for me.
I don't hear an echo.
Good evening, PUSD students, staff, families, and community. Welcome to our third Youth Town Hall. My name is Ria Apodaca, and I'm the Director of the PUSD Health Programs Department. Tonight's event is part of a collaborative commitment among PUSD employees for health programs, K-Learn, and communications, and our community partners from Huntington Health, Exeter Urgent Care, and the Los Angeles County Department of Public Health. We are going to present and discuss topics related to sexual health, including sexually transmitted diseases, infections, confidentiality, and healthy relationships. According to the CDC, sexually transmitted infections are common, especially among young people. There were 26 million new sexually transmitted infections in 2018 in the United States. About half of these infections are in people between the ages of 15 and 24. In 2021, the California Department of Public Health reported that the highest STI, sexually transmitted infection, rates occurred among young people aged 15 to 24 years. These statistics and the experiences of our panelists have brought us together for this event. Our purpose tonight is to dispel myths and provide correct information. Tonight, we will be sharing sensitive topics and images. You might hear something that causes you to feel differently or that makes you feel uncomfortable. If that happens, please know that it is normal to feel unsettled or off sometimes. If you need to step away for a minute, please do it and give yourself the space you need. This presentation is being recorded and will be available for viewing at a later time. Now I would like to introduce our moderator, Dr. Aspasia Mikhail. Thank you.
Thank you, Ria. Good evening. My name is Aspasia Mikhail, and I'm an emergency medicine physician at Huntington Hospital and the site medical director at the Exeter Urgent Care in Pasadena and La Cañada. We are so honored to be here with you virtually today, this time to discuss a topic that most people are uncomfortable discussing: sexually transmitted infections, or STIs as we'll be referring to them moving forward. We will be focusing on STI awareness, prevention, treatment, and where to go to get resources and treatment. Our discussion tonight will be led by a diverse panel that is a result of the collaboration between the Pasadena Unified School District, the Los Angeles County Department of Public Health, primarily their Wellbeing Center, Huntington Health, an affiliate of Cedars-Sinai, and Exeter Urgent Care. On our panel tonight, we have Dr. John Rodarte, pediatrician at Descanso Pediatrics with Huntington Health Physicians, medical director for the Pasadena Unified School District, and former chief of pediatrics at Huntington Hospital. We also have Dr. Charles Bugg, emergency medicine physician at Huntington Hospital Emergency Department and Exeter Urgent Care. We also have Dr. Amay Singh, youth educator supervisor at the Student Wellbeing Center of the Los Angeles County Department of Public Health. We have Timothy Valdez, youth educator at the Student Wellbeing Center of the Los Angeles County Department of Public Health. And we have Brittany Martinez, youth educator at the Student Wellbeing Center of the Los Angeles County Department of Public Health. Our panel will lead a very educational discussion on STIs, and it will be followed by a dynamic question and answer sessions. Please know that all of our questions were submitted in advance, and as always, we will do our best to answer as many questions as possible. Our goal is not only to educate you on STIs, but also to encourage you to be able to have an open dialogue about having a safe and healthy sexual relationship. We are grateful to the Pasadena Unified School District, specifically to Ria Apodaca and Katia Ahmed, for allowing us this venue to accomplish this goal. On that note, I will pass the mic on to Dr. Rodarte.
Thank you, Dr. Mikhail. As mentioned, I'm Dr. John Rodarte. I'm a general pediatrician in the community for over 20 years. And tonight, the goals of our discussion are several. First, to understand what is a sexually transmitted infection and the different types of infections that exist. Knowing the forms of prevention. How do you keep from getting an STI? Also, how do you treat an STI? And, as we mentioned, this is a difficult subject. It's hard enough to speak from person to person, partner to partner, and probably even more so from parent to child. So we really want to encourage an open and honest discussion about the sexually transmitted infections. And here there is no shame or judgment. And then finally, we also want you to know where to go for help and where to go for treatment as well. So first off, we'll say, what is a sexually transmitted infection? Or STI. They used to be called STDs. We typically just use STI now. Well, infection STI is an infection that is passed on from one person to another via sexual contact. And there are different forms of contact that we'll get into that later on as well. As mentioned previously, there's, in terms of the prevalence, since 2021, the incidence of sexually transmitted infections, primarily chlamydia, gonorrhea, and syphilis, have all gone up. The CDC, the Center for Disease Control, has estimated that people between the ages of 15 to 24 years old acquired half of all new sexually transmitted infections in 2018. So yes, this is something that is out there, is something to be concerned about. Now we're going to go over a few different myths versus facts. So first myth is, you only need to worry about sexually transmitted infections if you are highly sexually active. Well, the actual fact is that just one encounter, one sexual act is enough to get a sexually transmitted infection. There are factors that do put people at higher risk. Your behavior, if you have risky behavior, the type of sexual activity you're involved in, the types of protection methods you use or do not use. Also, sometimes the lack of education about STIs or worrying about confidentiality and who do I talk to about this? And finally, not knowing how to pay for treatment can also be a risk factor for people with potential STIs. The next myth would be only people who have multiple partners are going to get sexually transmitted infections. Again, the fact is that it takes only one partner or one exposure to get that STI. So again, behavior is a big factor with that. Are you having unprotected sex or with someone whose background is unknown to you? Have you had multiple sexual partners, or maybe your partner has had more than one sexual partner and may not be aware of their history as well? Another thing that can lead to bad behavior, drug use. That alters one's judgment, and because of that, it can alter how safe you are when it comes to having sex. The next myth is you can't get a sexually transmitted infection from oral sex. Well, the fact is that yes, sexually transmitted infections can be spread by oral sex. In fact, basically every different type of sexual activity carries a risk, whether that be oral sex, vaginal, anal, kissing, or even skin-to-skin contact. And again, we'll talk more about these in detail later in this discussion. I believe the final myth is that all forms of birth control prevent sexually transmitted infections. In reality, condoms are the only contraception that provide effective STI protection. Again, maybe not 100%, but pretty high up there. But the other types of protection, especially abstinence, that's the only thing that's foolproof. That one's 100%. But condoms, as far as actual contraception, that's your next best thing. Birth control pills, they only protect you from getting pregnant, but they do not protect you from contracting a sexually transmitted infection. So I think we're going to move on now to Dr. Bug, who's actually going to talk about more of these STIs in detail.
Dr. Rodarte. So I'm Dr. Wally Bug. I'm an ER physician over at Huntington, and I work at Exeter as well. And these are the STIs that we're going to discuss, the ones that are most prevalent and most important in this age group and in our community. There are a few other ones that we're not going to discuss because they're just not as prevalent in the community and therefore not as important for us specifically. We're going to talk about chlamydia, gonorrhea, trichomonas. These are ones that are characterized by a discharge or a fluid coming out of some part of your body where it shouldn't be coming out of. We're going to talk about syphilis. We're going to talk about herpes. We're going to talk about HPV. We're going to talk about hepatitis and HIV. So first group of STIs that we're going to talk about are STIs that are usually associated with an abnormal discharge. So discharge is basically a fluid that is coming out of a hole in your body where that fluid should not be coming from. Okay, it may look like pus or green or some other color. Okay, there are 3 STIs that basically fall into this category. And the number 1 and number 2 most common STIs, namely chlamydia and gonorrhea, are in this category. So they're associated with a discharge. There's a third called trichomoniasis that is not as common, and it does not affect any other organs in your body. Most of the other STIs that we're going to talk about can potentially affect many organs in your body if they're not treated early. Okay. These STIs associated with the discharge are transmitted via direct contact with infected bodily fluids. Okay. Many of the people who are infected with these may not have any symptoms. So you may not know that you actually have it. Okay. They're diagnosed via swabs or via urine. And for these, we do have treatments and cures. We can eradicate them completely with appropriate treatment. For people with a vagina, we're talking about in these STIs, specifically chlamydia and gonorrhea, especially, a discharge usually from the vagina or some pelvic pain or discomfort urinating. Okay. Late consequences of this can include ectopic pregnancy, which is a pregnancy that is not growing in the correct location and is unsafe to continue to term. Okay. It can also cause infertility so that you cannot get pregnant, and you can become a chronic carrier and continue to infect other people with these infections. Similarly, with people with a penis, the discharge is usually coming from the penis. There's usually discomfort with urination. Sometimes there is testicular pain as well. And the late consequences here do also include potentially infertility, less commonly than in people with a vagina, but still possible. You can be a chronic carrier and continue to infect other people if you're not treated appropriately. The next thing we're going to talk about is one that is making a comeback with hugely increasing rates lately, syphilis. The rate has increased by about 30% just from 2020 to 2021, and it's only continued to increase since then. Most of the new cases are occurring in men, but the rates of infection in women have been increasing astronomically as well. Okay. This one you can contract via direct contact with a sore during sex. So this is a STI that is among a group of STIs that is associated with sores on your body or skin findings on your body. Okay. It's diagnosed via a blood test typically, and there is definitive treatment and cure for this. Okay. Syphilis occurs in 3 stages. The most common stages that we see are going to be stage 1 and stage 2. So we're going to talk about those in more detail. Stage 1 on the next slide here is something that happens basically within 3 to 90 days after you're exposed to it by having sexual contact with somebody who has an infectious sore themselves. And typically you're going to develop something called a chancre, which is a painless bump or sore on the area of your body that contacted the infectious person's infectious sore. Okay, so typically it's going to be on the genitals, in the throat or the back of the mouth in the case of oral sex, or on the anus or on the vagina. Generally, these can heal kind of on their own within 3 to 6 weeks without treatment, but that does not mean that you are not still carrying the disease and may go on to develop further symptoms of the disease. The second stage, the typical manifestation is going to be a rash that we see, okay? Oftentimes on the palms and soles. It can occur within a few weeks to a few months after the initial bump called the chancre that we talked about. All of the 3 stages in this case of syphilis are reversible with treatment, but it depends on where you are in the disease, how long that treatment needs to be. Come on the next slide to another STI that is associated with skin findings. This one is called HPV or human papillomavirus. There are over 200 different types of human papillomaviruses. Some of them just cause common skin warts, and some of them will cause genital warts, which is the sexually transmitted forms. Okay. In all of these cases, once you have the virus, you may go on to carry that virus for life. Some people will spontaneously clear the virus and get rid of it through their own immune system, but other people will carry the virus for life. If you are carrying the virus for life, you are potentially at higher risk for certain types of cancer. Okay, those types of cancer are cervical cancer. Almost every cervical cancer is associated with HPV infection, penile cancer, anal cancer, and a number of other cancers. There is a vaccine now that can prevent the major cancer causing strains and help to prevent infection with HPV. Okay, those are available starting early on. If you start early enough at age, it goes down to I think age 9 now, you can get away with 2 doses. If you start to get your vaccine a little bit later, you need 3 doses of vaccine, but you can get the vaccine through your healthcare provider. There is testing available for HPV only in females, okay, during cervical cancer screening. There is no test in males, okay, and there is no cure once you are infected and are a chronic carrier, but you can treat the warts by freezing them, burning them, cutting them off, or using topical medications on them. This other next disease that we're going to talk about is another STI that is associated with skin findings. In this case, blistering skin rash. Okay, this is herpes. And there are two main types of herpes infections that cause sexually transmitted infections. Herpes type 1, which is more classically associated with cold sores on the lips, but it can also cause genital infections. And herpes 2, which is classically considered to be genital herpes. But remember that both of these viruses can infect the genitals or the throat or the mouth or the anus or any other part that comes into contact with an infected lesion. These are transmitted via direct contact with somebody who has an outbreak typically, but also sometimes with people who are infected but are not showing signs of an outbreak. Basically, the virus lives in your body and you get recurring outbreaks leading to these painful blisters on a fairly regular basis once you're infected, okay? Testing is done via a blood test typically, and there is treatment available, but it does not cure or get rid of the virus completely, but it can shorten the duration of the outbreaks, okay? And it's important to know that once you are infected, even when you're not manifesting the symptoms of the rash, people can still shed virus and transmit the disease. We're on to the next slide.
1 second, please.
All right. So the next two diseases are viral diseases as well. These are called hepatitis B and C. Okay. These affect the liver, causing inflammation in the liver. They're transmitted via bodily fluids, so vaginal secretions, semen, as well as blood. Okay. Early symptoms of infection can include yellowing of the skin, abdominal pain, darkening of the urine, and later symptoms, chronic infection, can lead to liver disease called cirrhosis or even liver cancer. And these are potentially fatal, just like essentially most of these diseases if not treated appropriately. Testing is via a blood test. Okay. There's treatment for hepatitis B to help control symptoms, and but there's no cure for hepatitis B if you develop chronic hepatitis B. However, in the last 10 years or so, they have developed treatments that are curative for hepatitis C, which has been an amazing advance over the last decade or so. There is a vaccine that exists for hepatitis B, but there is no vaccine for hepatitis C. So you can prevent getting hepatitis B by getting vaccinated, but you cannot prevent yourself from getting hepatitis C, but you can be cured of hepatitis C if you do become infected. And our final STI that we're going to discuss today is HIV, one of the big ones. This one is transmitted also like the hepatitis viruses through bodily fluids and blood. Okay. Early illness is fairly non-specific and fairly similar to having the flu. You might have body aches, headache, a sore throat. Oftentimes you'll have a rash on your body. You'll feel unwell, and it'll last typically a little bit longer than a normal flu infection. Testing is with a blood test, okay? And there's an important concept here that you have to get tested several times. If you get tested immediately after you had sexual contact that may have transmitted the HIV to you, you will test negative, and you need repeat testing up to 6 months after the exposure to finally test positive. Okay, that's a concept called the window period in HIV. There is treatment, antiretroviral treatment, to control the disease and keep the virus at low copy numbers in your body so that you cannot even transmit it to your partner if you're on appropriate treatment. But it's not a cure, but it does prevent progression to the most severe form of HIV infection, which is called AIDS, or acquired immunodeficiency syndrome. Okay, that's a late stage of infection that has many different manifestations and is ultimately potentially again fatal. There are several uses of antiretroviral drugs. One is pre-exposure prophylaxis, and this is a fairly new development as well. Basically, you take an antiviral medication in order to prevent contracting HIV during high-risk sex. Okay, so you're taking this before you have sexual contact with somebody who might have HIV, whom you might contract it from. And there's the concept of post-exposure prophylaxis. If you had sex with somebody who is high risk, then you can take medications after exposure to help prevent acquiring HIV from that person. With the HIV and even with the other STIs, it's important to get tested. Okay. Remember, we said that many people carrying some of these are asymptomatic. Okay. So we have to test to really diagnose them to be able to know what to treat. Okay. It's recommended that if you have a sexual contact during which you may have contracted an STI, you get tested at the time of exposure. Okay. And repeat testing at around 2 month and then 6 month intervals. Okay. It's important that you set yourself reminders for testing because it's important that you remember to do it so that you can take care of your health. And it's important that you don't have any unprotected sexual intercourse until you're cleared, okay, and you've done your testing. It's important, as always, to discuss these things openly with your partner because they're at risk too if they're having sex with you after you've contracted an STI. So it's important that you communicate within your partnership, and we're going to talk a little bit more about that. At this point, I'm going to hand it on to Dr. Singh, who's going to take over.
Great, thank you so much. Good evening, everyone. My name is Dr. Amay Singh. I am a youth educator supervisor with the Student Wellbeing Center, specifically for the purpose of our gathering tonight. We are actually located in several high schools, but in Pasadena Unified, we are at Pasadena High School. So before we go in a little more depth with how to communicate with partners and youth rights, I just want to give a brief overview of what the Student Wellbeing Center is because they will be popping up in conversation in the next few slides. So essentially, the Student Wellbeing Center is a program that was launched by LA County Department of Public Health, and it is designed to be a youth-only safe space where our team empowers students to make healthy decisions throughout their life. And we do so by providing education and resources. And that can include limited STI testing and treatment. But that's essentially us in a nutshell. So next slide, please. So youth have rights that are protected by the state of California. And the first one I want to highlight is the California Healthy Youth Act, which says that middle and high school age students have the right to access inclusive, fact-based, gender-affirming, and unbiased sex education. In addition to that, youth have the right to have someone explain their rights to them in a way that they understand. They have the right to access reproductive and sexual health care and information. Youth also have the right to choose their healthcare provider, given that it's covered by Medi-Cal or an approved insurance provider. Youth have the right to seek transportation so they can receive timely healthcare services, and this can be on campus, this could be off campus. If people are interested in what the on-campus protocol looks like at their respective schools, they can talk to an administrator, a teacher, a counselor, their principal. Youth also have the right to access birth control and protection of their choice. And then they also have the right to have privacy when it comes to storing personal items like birth control and the protection of their choice. Next slide, please. Great. So the state of California also protects confidentiality for youth. So what does confidentiality mean? It means privacy. So we really encourage youth to talk to a trusted adult in their lives when it comes to their health, but by law, they are entitled to seek certain types of care without parental consent, and that remains confidential. So services that they can access at any age is birth control, pregnancy testing, prenatal care, abortion, healthcare that's related to rape or sexual assault. If youth are ages 12 and up. They have the right to access STI and HIV prevention, care, testing, and treatment. All this without parental consent, all remaining confidential. In addition to that, oh, sorry, could we go back, please? Thank you. Youth have the right, so any information that's shared between the doctor and the youth, that also remains confidential. There are a few instances where that confidentiality are broken, but that's the general rule of thumb. And youth also have the right to understand or find out who has access to their medical information before they agree to receiving a type of healthcare. So with that, I'm going to pass it on to my colleague, Mr. Tim Valdez. Thank you.
Hi, everyone. I'm going to be talking about ways to communicate about STIs. At the Wellbeing Center, we emphasize how students may be feeling uncomfortable when having a conversation about STIs. And we want them to know that it's an important opportunity to strengthen a relationship with a trusted adult or an educator. If someone has tested positive for an STI, they should speak to a trusted adult, visit a health center for treatment, notify sexual partners or a partner, and encourage partner to get tested. How to communicate about STIs. If a person is looking for a way to communicate about their STI, it could be important to plan ahead. Thinking about what you want to say, who you want to say to a trusted adult or educator. It could be important to consider privacy, because it's a sensitive topic. Intentions, maybe think about like what are you going to say, and like necessarily like why, and like how are you trying to get it across. And then potential reactions, think about how like somebody think about like the person you want to speak to and who will receive you in the way that will make you feel more safe and comfortable. And then expectations, there may be like certain expectations set upon youth, but that can also inform the way you or who you want to speak to so you can feel more safe and comfortable. Re-emphasize that there's no perfect time to communicate about STIs. It could be a very sensitive topic. And it's okay to wait until you feel relaxed and able to communicate about your very sensitive or private situation. Which also goes back to the location. You want to make sure to pick somewhere where you feel safe and comfortable. Healthy relationships. Youth should know that healthy relationships are a spectrum. It could be healthy, unhealthy, or abusive relationships, which we'll go over in the next slide. Relationship rights. We emphasize to students that they have the right to say what they need to say, always be treated with respect and as an equal, to be themselves and have their own space, to say no to something they don't want to do, and then also they have the right to abstain from sex or practice safe sex. Communication is always a big part of healthy relationships, and it's something that our students are encouraged to practice in their daily lives. Students should know that gender expectations can be set upon them, and they may be experiencing them, but it's important to learn from each other and think about how they want to continue with their relationships. It's important that sexuality is known to be it's more than sex, and that it has a lot to do with a relationship. It could be romantic, it could be aromantic, and that's something that youth should definitely know because sexuality can be misconstrued as something that it's not. Next slide, please. This is the healthy relationship spectrum. It's a tool that is used in our centers to help students understand the different ways that a relationship could be healthy, unhealthy, or abusive. It's important to know that a healthy relationship should be including like making mutual choices. People are treated as equals. There's honesty and trust and mutual respect. Next slide, please. And then consent fries. This is another tool that we use in our centers. Youth should know that in order to consent fully with somebody, it should be freely given. Nobody can be forced to consent to any act. Consent is reversible. Just because someone has previously consented to something doesn't mean that they cannot reverse it and say that they don't. Consent is informed. It's important to know your STI status or know your partner's STI status before engaging in any sexual activity. Consent is always enthusiastic. A person should have enthusiasm or should be some level of excited or open or happy that they're engaging in an activity versus like feeling sad or like confused. Consent is specific. A person can consent to specific sexual acts. It doesn't have to be all encompassing, and which goes back to it being reversible, that a person can decide to take away their consent at any point they feel that it's right. Next slide. We're going to hand it over to Brittany. Thank you.
Right. Hello, everyone. My name is Brittany, and I use she, her pronouns. I'm one of the youth educators for the Student Wellbeing Centers for LA County. So I'm going to start off with some potential barriers to receiving services. It is important to identify any perceived barriers to receiving health-related services specifically, so that folks can identify their needs and find resources, programs, or support systems that can help find solutions for those needs. So some barriers to culturally competent care include language and literacy level. This includes things like not having a translator available when needed, or being able to understand written and verbal communication. That can include flyers, pamphlets, and things like that. Cultural and social background, as well as comfort with discussing sexual health issues, are kind of related, and that just includes anyone's attitudes or behaviors in regards to sex. And then previous experience with STI screening or testing. So some folks might not want to receive care if they had a previous negative experience, either before, during, or after their appointment. I do know that some students that come in with this concern, they are part of the LGBTQ community and just feel discriminated or they don't feel comfortable. And so this is an important need to address when receiving these types of services in general. And the last one is history of sexual abuse and or domestic violence. So some forms of trauma may prevent folks from speaking out and receiving help from anyone, really. Next slide, please. So the next two barriers are discussed often, especially with our students, and that's lack of education as well as cost and access to care. So the first topic includes awareness. Studies have shown that sex education increases awareness and knowledge, and with this, it can improve attitudes towards sex as well as reduce stigma towards sex. It is also important to note that this information should be delivered by someone who is comfortable talking about this information. I know that some students had concerns in the past with just the educator not feeling comfortable or not giving them a safe space to communicate about these different topics. So if that is a concern, please address that to a teacher, admin, and staff. The second topic touches on lack of transportation, as well as not being able to pay for services, confidentiality concerns, and location of services. I'm going to address the lack of funds and or insurance later, but I do want to bring it back to what Dr. Singh mentioned previously, and it's that California minors have rights, and this right includes receiving STI testing and treatment services. And as Dr. Singh mentioned, these services can be provided on campus depending on the school and the district. And these services can also include transportation services. Parents do not need to be involved in the appointment making or in the traveling to these appointments. And these can be made during school hours as well. So I just want to emphasize that students do have these rights. It is important to ask admin, staff, the nurse, or anyone really about the resources and different programs available on specific sites or on specific campuses. All right, so now that we went over some barriers, I'm going to discuss some prevention and treatment options. So some of these points were already sprinkled around through this presentation. I'm just going to quickly go over some of them again. So abstinence is the only way to guarantee protection from STIs. Vaccines are also available and highly effective at preventing hepatitis B and then some strains of HPV. Condom use. So this is important to understand that consistent and correct, that's the key word, correct use of condoms reduces the risk of STIs. And it's not 100% effective, I should say. It's probably about 90% effective or more if used correctly. So that doesn't include using two condoms at one time. That's not included in this. I do also want to point out that some STIs can still be transmitted through condoms, which is why it's not about 90% effective. And as mentioned earlier, this can include like syphilis or anything with skin-to-skin contact. So HPV and herpes. I also want to add that there are different types of condoms. So really kind of explore the different options out there and see what works for someone. Testing before any sexual activity is not always discussed, but this is a prevention method that is suggested for folks who are already sexually active or who have already had sex. So knowing someone's STI's status is a critical step to stopping STI transmission. And this just requires anyone who is involved or about to engage in sexual activity to get tested and then share the results with their partner or partners if it is a group thing, or if they're having sex with multiple people. And once those test results are negative, then it is safe to say that you all or the folks can engage in sexual activity without transmitting STIs. And the next one is medications. I'm not going to really get into that, but as mentioned, there's PrEP, and there's also this medication called DoxyPEP, which can help prevent STIs. All right, so what happens if someone needs to get tested or receive treatment for STIs? Let's say these prevention methods don't work and someone needs to get tested. So what we do is we, for the Wellbeing Center specifically, we have nurses and Planned Parenthood or other folks come on campus and they can provide those services to students. For campuses that don't have this, we do recommend going to Crown City Medical Group or Planned Parenthood. And these two clinics provide low cost to no cost services, and they are local to Pasadena. They are in the Pasadena area. I also want to briefly mention Family Pact. So this is a program that provides free family planning services to folks who do qualify. So it is important to just know what that is and be sure to ask about the service when scheduling an appointment or going to an appointment. Okay, on the next slide, we have included other organizations that provide free to low cost care. If anyone is interested in these services, please scan the QR code and it can just send you directly to the web page. I do want to highlight the two bottom organizations. They do deliver testing kits to someone's home, and these can be delivered discreetly to maintain confidentiality. A student or someone just has to go in and call them, call staff, or just make a note of it that you want to make it private. So their logos or anything like that is not on the packages when they send it over. Okay, and on the final slide, we have displayed some questions students have asked us about sex. We understand that conversations about sex, it might be funny to a few people. It might make folks feel uncomfortable. It might be awkward, and that's okay. We do want to normalize any types of questions in regards to sex. We do also want to provide a safe space for students to ask freely, freely ask any questions that they may have on this topic. We've heard it all. We're not afraid to answer any of these questions. So at this time, we are going to address some of the questions that were included in the group, the Google form. So.
Thank you, Brittany. Thank you to the panel. And we're going to discuss the questions that were sent in advance. And the first question we're going to ask is, how can I prevent getting an STI? And I know we just went over it, but it'd be nice to get a recap of that. And on that note, if people are taught to properly use condoms, will that keep them from getting sexually transmitted infections? So who would like to answer that question?
I mean,
Dr.
I can
Bug.
have a shot.
Okay.
So, as discussed, condoms are the most effective way that we have beyond abstinence, okay, or not having sexual intercourse. Condoms are the best way to prevent transmission of an STI. Now, as mentioned, there are a few that can still be transmitted potentially, okay, and condoms themselves are not 100% effective, okay. If correctly used and used every time during every act of sexual intercourse or every sexual act, then they're about 90% effective, okay. There are still a few that can be transmitted. Herpes, HPV was mentioned, even despite using condoms. But if you are going to be engaging in sexual activity, you should wear a condom every single time, okay. And as mentioned, there are different types of condoms. There's female condoms, male condoms. Male condoms are the ones we're most familiar with. Generally, they're sold virtually everywhere. You can get them for free from Planned Parenthood and probably even at your school. Um, they come in all different sizes. They stretch incredibly well. So they there's a condom for everybody out there, and you should use a condom if you're going to make the decision to have sexual intercourse.
Great, thank you so much. Our next question is, how do I know if I have an STI? Okay, well, I'll let Dr. Bug or Brittany, whoever wants to go first. Dr. Bug, go ahead.
Oh, I mean, we addressed several of them. So the first prerequisite is obviously that you've had sexual intercourse, and the thing that we mentioned on many of these is that you can actually be asymptomatic. So in some cases, you can't know, at least by the symptoms that you have. Okay. Um, there are many different symptoms potentially associated with different STIs. We talked about some major ones, either some sort of bump or rash on the skin. And we talked about STIs associated with discharge. Okay, so anything unusual, any fluid coming out where it shouldn't be coming out of, that's potentially suspicious for an STI. And then, beyond that, you have to get a blood test for many of these. Okay, so we're talking about you can have early non-specific symptoms for HIV. Hepatitis can be similar, even, and you want to make sure that you're getting tested appropriately if you are concerned that you may have contracted an STI.
Okay. Someone want to add to that? And so the next question is, well, where do I go to get tested for an STI?
I'll
I'll
add.
just answer that.
Okay.
Go ahead.
Yeah, sorry. So again, I did mention a few clinics that are available. Planned Parenthood is always someone we recommend. We do have a partnership with Planned Parenthood on our other campuses. So we do recommend Planned Parenthood. There are different clinics and just hospitals around as well. I also want to say that the 2 QR codes that I did put out there, they also have links, and yeah, those 2 QR codes. They also have different sites available. So if you just put on a zip code, they can provide you to different clinics as well in the area that's closer to you.
Dr. Rodarte, did you want to?
Yeah, I'll go ahead and add, I think those are really probably the resources that I like the most for my patients. We do have the option of testing in the office when you go to your private doctor. The only issue with that for teenagers is that often that will actually go through your insurance. And because of that, it may not be as confidential as you'd like it. So I think doing the Planned Parenthood or other sources of that are probably the best way for teens to be able to keep their confidentiality if they'd like to. I always encourage teens to be able to talk to their parents. I love that when I get that situation, that's the best to me. When I have families, they're like, yeah, we'll talk about it. We're open about it. And then we can go ahead and do testing through my office. But otherwise, the other resources are great.
Thank you. Thank you, Dr. Rodarte. Thank you, Brittany. The next question is, who should get tested for STIs?
I'll go ahead and answer. Yeah, so who should get tested for STIs? That's a great question. Honestly, it's anyone who is sexually active or engaging in any sexual activity. Um, this includes like if anyone who, because kissing is also involved, right? So someone can still get an STI through herpes and kissing and things like that. So if someone suspects another person has it, or if there's, if the STI is showing and it's being flared up, then also I would get tested after that as well.
I'll add to that as well that, once you are tested and you're in a new relationship, if the two of you are monogamous, so you're only partners, at that point, then you can be assured that you're more safe if you've both gone through testing already. So you don't have to continue testing, but to get testing before the start of a new relationship is really the safest for both of you, for both partners to do it.
Great, thank you. And how do I tell my partner I have an STI? Timothy?
Hi, thank you for asking an important question. We talked about it earlier in the presentation, just reiterating. It could be a difficult conversation to have, but it could be important to think about it as a way to strengthen a relationship. Planning ahead is a good method of thinking about communicating an STI. So thinking about the place, your location, thinking about like who is a trusted person in your life that you feel most safe and comfortable to talk to. Um, yeah, would anybody else like to add?
I would agree. It's a very difficult thing to talk about. Also depends on if you are in an ongoing relationship with that person, how you discuss that with them, and when you contracted that STD during that relationship or previous to that relationship. So there are a number of factors that could really make it extremely difficult. Nowadays, I mean, I will be honest, I'm sure there are people that do it through text message or through an email because they're afraid to talk to you in person. In person is always the best, but sometimes, especially if it's not a current partner that you don't have regular contact with, at least sending them that message so they can know that they should get tested as well.
Great. Can you have more than one STI at a time? I think Dr. Bug or Timothy
Yeah, sure.
or Dr. Bug first.
Okay. Yeah, so absolutely. You can have more than one STI at a time. Okay. So these STIs are not mutually exclusive. You can contract multiple STIs at the same time and be infected with any number of STIs at the same time. So it is important that you get comprehensive testing and not just test for, one thing and stop at the first one once you test positive for that. So it is important that you get tested for all of them. Um, regularly if you are engaging in sexual intercourse, especially if you are changing partners or having intercourse or sex with multiple partners. So you definitely, it's potential that you can have any number of them.
Great, thank you. Timothy, did you want to add to that?
No, that's perfect. Yeah, it's unfortunate, but you can contract multiple at the same time.
Okay. And
It's,
what
it's
are
also, I'm sorry,
sorry.
can I just add to that? It's like some of these you can contract again. Okay. So that's also an issue is like once you've had one and you've had it treated, you are still susceptible to that same disease again. So just because you had chlamydia once and you got treated for chlamydia doesn't mean that you can't go on to have chlamydia again. So there's no immunity per se to many of these.
Okay, great. Thank you for that clarification. What are the behaviors that cause people to get sexually transmitted infections? And would washing your penis or vagina after sex lower the risk of becoming infected with an STI? Dr. Bug?
All right, I'll take this one. So, we talked about some of the behaviors earlier, and it's especially we're talking about if you're having sex with multiple partners, every partner that you have sex with is a potential new exposure, right? So if you're monogamous with one partner and you've both tested ahead of time, then you're only having sex with each other. Um, then you're pretty safe. But if you are having sex with multiple partners, that's a risk factor. If you are intoxicated with drugs or alcohol, that lowers inhibitions and makes you less likely to use condoms every single time, for example, um, and to engage in more risky behavior. So those are like a lot of the behavioral issues that predispose you to potentially getting an STI. Those are several of the main factors, I would say. Dr. Rodarte had addressed several in his slides. As to the specific question of if you're washing your genital area after sex, does that prevent getting an STI? It does not. Okay. The bacterial counts are somewhat reduced by washing your hands and washing your genitals, but you've already potentially exposed yourself and your mucous membranes to the pathogen during the sexual act. Okay, so going back and washing afterwards does not prevent getting an STI. And there's no significant evidence that it really reduces the risk of getting an STI either. And in fact, some of those hygiene practices can actually damage the skin if you're washing too aggressively and predispose you to actually be more susceptible to getting certain infections. So you have to be a little bit careful there.
Great, thank you. Next question is, can I get an STI if my partner has no symptoms?
I'll just go ahead and answer. So question one, can I get an STI if my partner has no symptoms, correct?
Yes.
So yes, someone can get an STI even if there are no symptoms present. As we've mentioned, the most common sign of an STI is actually no symptoms. So yes, it's very possible to get an STI. It's always best, as we've been saying, and we're going to continue to say this because it is important to get tested and to continue to get tested after having sex or sexual intercourse.
Great, thank you. So I'm going to piggyback off of that with one of the questions that are on the slides, but it says, should I kiss my partner while I have a cold sore?
And I can address that. It's while you have a cold sore, you are manifesting a symptom of either HSV1 or HSV2 or herpes simplex 1 or herpes simplex 2 infection. And you are shedding more virus than you would if you did not have an actual rash. So you are potentially infectious. You can infect your partner. So it's not a good idea, in my opinion, to, kiss your partner or have any sort of contact with any, uh, you know, any of the infectious lesions during an outbreak, because it can be transmitted in that way.
Great. And can I get an STI from a public toilet?
I'll answer this one if I can. Essentially, no. The bacteria, they really like to live on the human source, so they really don't stay active on a toilet seat. So essentially, no, you really cannot contract one from a toilet seat, thankfully.
Great, thank you. What do you identify as the reason there has been such an increase of sexually transmitted infections in the school district?
I'll add to that question. I'm not sure that there really is an increase in the number of infections within the school district. In general, infections have been increasing over the years, but not isolated to our school district at Pasadena. It's just in general, there is an overall increase all over the place. And part of that, I mean, there's a lot of different things. I mean, after the pandemic and people having, time together again, that could be one cause of it. Changes in sexual behavior and what are the norms and what people are doing. There's a lot of, the multifactorial thing, but certainly not isolated to Pasadena Unified School District.
Dr. Singh?
Yeah, I think to add to that too, I mean, I think people are just reporting it more than probably before. And then also, as some of the barriers that were listed out earlier in this presentation, like lack of access to treatment or testing, that could also just be a factor.
Okay, great. There's another question here. So we talked about risky behaviors, but such as drinking and taking drugs, like why do they make getting STIs more risky?
Yeah, I'll touch on that again. Again, I think as Dr. Bug even mentioned too, really it's a matter of those type of things inhibiting your ability to be safe. If you're under the influence, whether that be in drugs or alcohol, a lot of times because of that, you become more lax in your safety. Maybe you're not wearing a condom every time, or you don't put the condom on from the beginning, or you might be more likely to have more sexual partners because you're under the influence. So those really, it alters your ability to remain safe if you're under the influence of drugs or alcohol.
Great, thank you. And here's another question, but it's for the school district. What is the school district's stance on promoting abstaining from the sexual behaviors that cause people to get sexually transmitted infections?
So public school districts are required by the California Department of Education to teach a comprehensive sexual health educational program. And I believe the question was on abstinence. Is that correct?
Yeah, on promoting abstaining from the sexual behaviors that cause people to get sexually transmitted infections.
Thank you. So abstinence is taught within the context of those lessons, and it cannot be taught in isolation without also teaching additional preventative measures as well.
Great, thank you, Ria. And I'm going to ask a question from the slide, but what are the most common STIs in teens?
Dr. Bug, if you want to, I think that was part of your talk. If you
Yeah, sure. Sure, I can address that. So the most common STIs in teens are going to be the same ones that are most common in the population. Okay, so the number one and number two are chlamydia and gonorrhea. So those are the ones that we see hands down the most, and those are the most common ones. Now, your others such as HSV, certainly quite common. Syphilis is on the rise. I don't have exact numbers on syphilis incidence in teens specifically, um, but those are chlamydia and gonorrhea are number one and number two.
Great. I think that concludes all the questions that were, I mean, there's one other question, but basically, what is the difference between sexually transmitted disease and STI?
Yeah, really, that it's just a difference in terminology. It used to be in my era, it was called an STD, sexually transmitted disease. But I think we've come to realize that it's really a matter of the infection. Sometimes the infection may not always show that disease process outwardly. So we've really changed the terminology to sexually transmitted infection to kind of better show that when you catch something, it is an infection. It may not be a full-blown disease yet once you first get that infection.
Okay, great. Thank you for making that clarification. So I think we're done with all the questions that were submitted. Thank you to our panel, and Ria, I don't know if you wanted to close it off.
Sure. I would also like to express just great appreciation for all the panelists and all of our K-Learn communications team and also the health programs team for organizing this event, including all of the other two youth town halls as well. So I appreciate it. Just know that this information will be available for viewing at another time. And also anybody is able to reach out to healthprograms@pusd.us with any questions following this presentation, or if you are seeking connection to any of our panelists, we can assist you with that as well. So thank you.
Okay, great. Thank you so much. And again, we appreciate the ability to give this presentation on this venue. So thank you all.